This is a new collaborative that we're announcing between Providence healthcare system and the University of Montana called Resolve. The big picture for Resolve is getting together the Providence healthcare system, their data, their clinics, their physicians, their clinical physicians, working together with the researchers at the University of Montana to look at how we can bring innovation to rural communities. Primarily in Montana to start with, but it's something that'll apply to the 7 states that the Providence healthcare system is in. The University of Montana and Missoula is the center of health-related research for the state of Montana. And so part of this is another indication that's who we are at the University of Montana. People living in rural communities are usually the last people to get these innovations in healthcare. And so what we're trying to do here is show how you can bring those innovations to rural states first, rural communities first, and have an impact there. Because the ways in which you do innovation in rural communities is drastically different than an urban setting.
The work is so important because rural providers are asked to do more and more with less and less. And we want to bring technology, we want to bring innovation, we want to bring solutions to providers that will allow them to for their job to be easier. People have to travel a long way for their healthcare. We have a lot of geographic distance in our state, and we want to do better. We want to do better for those providers so that they want to stay in their communities, and we want to improve health outcomes for our rural folks so that they can stay in place and get the care they need. I really believe in this work. I really believe in the long game of making improvements for healthcare.
10 years ago, this kind of the collaboration of this scale probably wouldn't have been as successful as it's going to be. Between 2014 and 2025, we significantly increased the research capacity at UM, especially in the area of healthcare. One of the biggest challenges we face in rural medicine is the recruitment and retention of caregivers. In Montana, there are counties that don't have primary care delivery. There are counties that don't even have mid-level care delivery. And while the University of Montana is focused on training healthcare providers, we have 7 different schools in the College of Health. We're starting a physician's associate program, which is mid-level. We've been running the family medical residency at the University of Montana for over 12 years now. And that's improving the placement of healthcare providers, but retaining them in rural areas is extremely challenging because they're so isolated. Part of Resolve, a significant part of Resolve, is collaborating with those caregivers on identifying barriers to access, issues that they believe could be improved through better research and better delivery of care.
I'm one of the founding members of Resolve 10 years ago that came back from the Mayo Clinic, started a practice here, and had a vision that we could create something that unified really the University of Montana and its strengths with Providence and St. Patrick and its strengths to be more than either of those institutes were by themselves together when we focused all of that energy on our rural populations and care. Resolve is really meant to be the machinery that allows us to change how care pathways and care is delivered in rural populations. So nobody's coming to save rural medicine, and it takes a collaborative effort with an enormous amount of people from different specialties that care a lot about rural populations, and really building research infrastructure and clinical infrastructure to change the way that rural patients are cared for.